Excuse me, ladies and gentlemen. Thank you for your patience in holding. We now have your presenters in conference. Please be aware that each of your lines is in a listen-only mode. You may submit your questions electronically anytime by using the chat pod located to the right of your webinar platform. You may also download a copy of today's presentation using the Files pod located directly above the chat pod. It is now my pleasure to turn the conference over to today's first presenter, Chris Hund.
Thanks so much, Ryan. Hi, everybody. How's it going? Welcome to the July 2019 AHA Team Training webinar. This is Chris Hund. I'm the director of the AHA Team Training Program and a director here at the American Hospital Association with the Center for Health Innovation. I think we have a great webinar today. It's about leaving a lasting legacy and really making TeamSTEPPS be something that sticks and continues on. Just some rules of engagement today. As always, you can listen to the audio for this webinar in two different ways. You can listen through your phone. If you do that, please make sure you just mute your computer speakers because you don't want to have a weird feedback happen to you. Or you can listen through your computer if you have a solid internet connection. Both works just fine. We do a Q&A session at the end of the presentation, and so we encourage you to chat questions in during the presentation. When you do that, we keep track of the questions and we try to put together a coherent Q&A so that we can really have a nice conversation at the end of the presentation. And any questions that we don't get to, the email addresses of the presenters are going to be listed at the end, and they've invited you to write them directly with any questions that you feel don't get answered during the course of the webinar. Just some upcoming events, courses for the rest of 2019. The rest of the master training courses in the summer and autumn are open. Some of them are already getting close to being filled up and there's a wait list, but some of them still have spots remaining. So if you are interested in any normal TeamSTEPPS master training courses, head on over to our website and check them out. We also have a new course that we're going to be doing for our friends that are in the outpatient care field. So we are thinking about this as being anybody in a medical office, primary care, outpatient, standalone, urgent care, anything that's not really specifically inpatient care. We have a TeamSTEPPS master training course focused on that. That will translate things into that environment, that language. So we think this is going to be really great. It's going to be November 6th through 7th in Durham, North Carolina with our Duke University Regional Training Center. So looking forward to seeing some of you there. I know that there's been a request for more outpatient type TeamSTEPPS work. So that's coming up. Also, within the next few weeks, we'll be announcing our annual conference for 2020, its location and its dates, so keep an eye open for that. We're actually really excited to have our speakers today because our speakers today did a great job presenting at our 2019 annual conference, which just took place last month in San Antonio. If you need us for anything, here's our website, our email. We'll get back to you as soon as we can, as well as our phone helpline. All right, so today's presenters, like I said, we were lucky to have them at the conference in San Antonio and got a chance to hear from them and hang out with them. And so I think you're really going to enjoy what they have to present today about sustainment, legacy, and keeping TeamSTEPPS going. They're both from Stanford Healthcare, the ValleyCare hospital within that system in California. So we have Joe Carlucci, who's the Executive Director of Physical Sports Medicine and Patient Safety Officer there, as well as Missy Malkin, who is the Medical Surgical Clinical Nurse Educator. There's been a lot of really cool stuff going on at ValleyCare for some years, and I think that you'll see that it's really the key to that success is what will be presented today. So without further ado, I'm going to toss things over to Joe.
Thank you, Chris. And if I can just echo Chris, and Jen and Abby did a great job working with us, and we were very privileged to be at the conference. The conference is a great time. I would highly recommend it. Chris did not ask me to say that, but I felt like I had to. So, my name is Joe Carlucci. I am the Patient Safety Officer for about 4 years at Stanford ValleyCare. ValleyCare is a community hospital in the San Francisco Bay Area. We have been affiliated with Stanford for about 4 years. So it's the integration of a community hospital and an academic teaching hospital. We have been working on our TeamSTEPPS journey for probably about 10, 11 years. And we're excited to present to you our revamping and our reinvigorating of our program. And now it's Missy.
Hello, everyone. Thanks for joining us today. So my name is Missy Malkin. As Chris said, I'm the Med-Surg Clinical Nurse Educator. I've been at ValleyCare a little over 5 years, and I've been in the educator role for about 4.5 years now. And my role with TeamSTEPPS is I lead our Med-Surg simulations, and I teach our TeamSTEPPS refresher course. So we'll talk about how we integrate our TeamSTEPPS content with our simulation classes, and talk a little bit more about that and where we've come from and where we're at now. So we wanted to start off with a poll, and so hopefully you guys can see all of our options here, but we wanted you guys to select what role fits closest to your role at your organization. We'll give you guys, a couple seconds, a minute to do this. Just trying to see who's in the house and what our audience is. So it looks like most of you guys have voted. Awesome, yes, and so it looks like there's a handful of other roles. So if you do select other as your role, please indicate in the chat box what role you do, what your role is at your organization, just so we can kind of get an overview. It was fun when we did this at the conference. We had a dentist in our audience, which was not a role that we were expecting, but it was a great addition to our group. So quality improvement, risk management, great. Oh, stroke program coordinator, awesome. We're actually in the process of becoming a primary stroke center. Critical care nurse educator, awesome. So yes, great, lots of quality and risk management folks. Perfect, thanks guys. We have one more poll for you. So we are interested in knowing your TeamSTEPPS history within your organization. So the choices are if you do not have a TeamSTEPPS program in place, if you have one that's been in place 2 years or less, 5 years or less, 10 years or less, or greater than 10 years. Perfect. So it looks like an average about 5 or less. Great. So there's quite a few of you that do not have a TeamSTEPPS program in place, which is great. We will be giving you guys lots of tips and tricks, as I like to call them, on how we have kind of taken our initial version of our program and we're calling it our TeamSTEPPS 2.0. So we will take you along our journey, and hopefully you guys will grab some good action items and little nuggets to start working on with at your organization. So just quickly, the objectives for today's presentation. We are going to help you find who are those key leaders and support people that will help you guys either, to create and implement your program or kind of take your program where it is to the next level. We're going to talk about barriers that you guys might encounter, and also what are strategies that we've used that have helped us to kind of, again, continue on to our version 2.0 and have really kept the sustainability of our programs going as, some key folks have transitioned on to other roles. I do want to point out in the file box that you guys see on that bottom left corner, we have a Leave a Lasting Legacy worksheet. If you haven't printed it out prior to coming on today and you have access to do that, we recommend that you print it out and have it in front of you. We will be going through some different kind of key elements on what we've done to keep our program ongoing and successful. And so we've created this document to be kind of like a working document as we go through our content. And so you guys can write down, you know, key people in your organization or strategies or measurements and things like that, which we'll get a little bit more in detail in the future. But it's a nice worksheet that you can then take after today's webinar and, you know, work with your groups and try and, you know, get your action plans and action items together and just have it be a working worksheet for you guys. So
I'm going to give you a little bit of a truncated history of TeamSTEPPS at ValleyCare. We've had TeamSTEPPS here for probably a little over 10 years. And as we were putting together this presentation and we realized TeamSTEPPS is about 13 years or so, getting into its teenage years, which those of you that are parents or we've all been teenagers, so we know there can be the growing pains. It started out at ValleyCare. On the left is Dr. John Nunez, who at the time was an OBGYN at ValleyCare. And in the center is Gina Teeples, who at the time was the director of maternal child. So they were the ones who had the vision for ValleyCare to start TeamSTEPPS. So our story is one of a lovely lady whose department delivered lovely boys and girls, all of them at hearts of gold like their director, but there was so much noise. And it's the story of a doc named Nunez who was busy with MDs of his own. They were OBs who worked all together, but they worked all alone. Till the one day when the lady and this fellow, they knew it was much more than a hunch, that this group must learn to work together. And that's how we all became the TeamSTEPPS bunch. So thank you for indulging me in a little 60s television. That was a lot of what I did when I was young. But this is now only even part of our group. Started out with just Gina and John, and now we've grown it to a very large contingent of people. Everyone you see there are master trainers. And so what we're going to do is take you through our journey to get to that point and how we can help you with this process.
So talking a little bit about our history beyond what Joe just kind of showed you guys. As he mentioned, Gina Teeples at the time in 2010 was the director of our maternal child department, and they were the first department within our organization that adopted our TeamSTEPPS program. At the time, Gina had seen the value of the team training and brought it into her department and paired it up with the massive transfusion simulations that they were conducting within the L&D space. And so our nursing staff and our lab staff were getting, you know, the team training, and it was quickly realized that this program became very robust. They were seeing performance improvement outcomes. The education that the staff were getting was then transitioning into this enhanced teamwork on the unit. And so really great things were happening in our maternal child department, but that was the only department that it was happening in. So we really needed to identify or create, I should say, a plan for sustainability throughout the organization. And, you know, what did that look like and how can we get that going? So Gina then became our chief nursing officer and again really saw the value of the team training within her department. So it became our organizational strategic plan and part of our safety plan. Our educator group, which comprised of unit educators and then our staff development educators, our staff development educators for our organization really are the ones that kind of provide education outside of just clinical staff as well, but on a more global hospital-wide front. And so both educator groups came together and we performed a gap analysis to see how can we kind kind of spread and create and offer our simulation courses with that TeamSTEPPS component to all of our nursing units. At the time, you guys can see in this graph, in 2014, we only had 8 simulations that were done in the entire year, and the majority of them were on our maternal child department and only 1 in our ER department. So once we identified those gaps, we were able, as you guys can see in this chart, to really increase the number of simulations across the nursing departments, which incorporated that TeamSTEPPS refresher. So we are projected this year, which is really great, to offer 62 simulations across our nursing units. But we've also started at the end of last year to do some simulations for our outpatient settings as well, or our outpatient departments. We've had our physical sports medicine department work on, and I'll talk a little bit about it later in our slides, but do fall simulations. We're having cardiac rehab staff do simulations. So we're really starting to kind of broaden. It's not just an inpatient focus. We're expanding our simulations. So, and we really attribute the success because our senior leadership does see the value in our team training, and it is a part of our organizational goal. And then we've also created a more consistent training schedule. So we'll talk more about those in a little bit.
So when we put together this, Missy titled this slide. I didn't title this one, but the idea is not to look for someone who is a physical therapist who eventually became a patient safety officer, but rather it's to look at characteristics and qualities and try to get people together on your team who will help to be successful. I've been at ValleyCare for about 28 years, and as I said, I was outpatient director, ambulatory services, became patient safety officer, and I started to get involved in the teaching. And eventually, Gina and John, as they moved on to other roles, I started to assume the primary teaching of our TeamSTEPPS. And so from that perspective, we want to emphasize, and we love that there's a lot of quality and safety people on, because it should not just be nursing and doctors. As Missy mentioned, we involve food and nutrition, we involve physical therapy, we involve all the disciplines. We haven't gotten as robust yet as we want to get, but we do need to get all the people in the hospital on board. When some of the physical therapy staff started to go, and I asked them, how was the program? This was before I was doing it, and they said, well, it's a nursing program. And we have to get away from that perception that it is just for the nurses. This has got to be a common language throughout your whole organization. Storytelling, very important. There was a pre-webinar question about high impact. You cannot make a greater impact than telling real stories. Think about times where you've been in a class, or if you've been to master training classes, and they show you those stories, the people relating something that happened. Those are the things that have the high impact. And as the patient safety officer, I have access to root cause analysis and Quantro's event studies, and I can use these, keeping them general, of course, to say these things really happen, and this is how either it was fixed or how there was a gap because of communication issue. So the storytelling was really important to the high-impact teaching. Consistency, we used to make it optional. You could take TeamSTEPPS if you wanted, if you got to it, great. And now, as Missy mentioned, and I'll talk a little bit more about how we did it, this is not optional, it's required. All people, when they come through new hire orientation, are required to take it. And as well, we have a program in place for all our current employees. And then the people who are going to be doing this, again, tenure and relationships, this is going to be important because this is not always something that's popular, especially people who, maybe not believe in it or not know as much about it. So the relationships with people, the slow adapter, so to speak, are going to be important. And again, the value of safety and quality involvement, and all of you are there. Use your stories, use your real-life scenarios in your teaching, in your simulations, and this will help people to understand that these things are real.
So in looking through or working on ways that you can sustain your program or even implement a program within your organization, you really need to identify who your key stakeholders are. Most of us, I would think, have seen this curve on the right-hand side whenever we're trying to either make a change, implement an initiative. You have people within your organization that are going to fall all along that curve. So you'll have your innovators and your early adopters, and then of course you'll have your laggards who, change may be a little bit more difficult for them. But really, when you're trying to look for who are your key stakeholders, you really want those people to be within that purple and green purple and blue part of the spectrum. And so for us, as I identify and kind of talk through these key holders for our organizations, the kind of titles that I'm going to reference may be different for you at your organization. But again, as Joe mentioned, we want to try and find individuals that emulate these characteristics that will help the success of your program, again, whether you're implementing or continuing it on. So leadership definitely by far is going to be one of the top key stakeholders in any successful program. They're going to, have the buy-in of the program, which Joe will talk a little bit more about buy-in in a minute. But they will see the value in that TeamSTEPPS or the team training programs. They will be the ones that will help to encourage and engage and influence the different departments to move forward, with whatever program you're either trying to create or revamp. For us at our organization, Joe is the patient safety officer, and we have some physician champions who've recently, within the last, probably a couple months, have verbalized that they're wanting to become part of our TeamSTEPPS team as well, which is huge for us because Joe will talk about our physician component, but they're just as important and as valuable to have and participate in the TeamSTEPPS program as well. Our influencer groups, those are really the presenters, educators, charge nurses within our organization. But again, those are the people within your organization that are going to lead the program. They're the ones that are teaching the classes. They're the ones that have attended the master training. And then really also, you want them to be people who are working with your end users, so to speak. So the ones that are involved with your patient care staff on a daily basis. They'll be speaking this TeamSTEPPS language, kind of always, translating whatever kind of is going on the unit into those TeamSTEPPS components, so that staff are constantly being not introduced, that's not the right word, but sorry, they're constantly having these concepts always out there in the forefront so that it just becomes second nature to them to start using the concepts as well. And then we identified when we started doing our TeamSTEPPS 2.0 revamp that we definitely needed some sort of project facilitator or project manager. This person is helping us to, make sure our meetings are consistent and we don't have long durations in between meeting times from happening. They're keeping our minutes, keeping our action item lists, and making sure that our program stays on track and doesn't kind of fade out. And so this can be a non-clinical person. For us, it's our staff development associate, and she is really great at keeping us on track and on target and making sure that we're have meetings regularly scheduled. So that's a very important component as well. Again, as we're going through our presentation, if you guys do have that worksheet in front of you, you guys can identify who your Joes are in box number 1. Box number 2, as we're kind of talking through the content, who are those key stakeholders in box number 2 that you would want involved in your next steps. So these are, again, kind of a working document as we're talking through our presentation.
So there was one also pre-webinar question about top-down or bottom-up, and I don't know that I would really, I know people like to use those terms, but I'm going to talk about how we achieve this. I want to say both. And this is not just a sloppy slide on my behalf. This is a nod to Ross Ermintrout, who taught my master trainer class. And he taught me this is not about buy-in, it's about ownership. Buy-in is when you have to convince somebody, and ownership is when you are part of the solution. So yes, you do need senior ownership, and you need to show ROI. Now, ROI in the financial sense of TeamSTEPPS, it's kind of hard because it's hard to quantify what has not happened. You can look at studies and say if you have a disastrous outcome on some behalf, it'll cost us X millions of dollars or whatever. But then again, that's all projection, and you're kind of hoping that it's not going to happen. So we decided that we were not going to make a financial argument for this program. We were going to make a cultural argument. So, and again, for those of you in the safety and quality area, you'll recognize all of this. Joint Commission Sentinel Event number 57, the essential role of leadership in developing safety culture. One of the tenets of what the Joint Commission asked for is a robust team training program to make sure that everyone in your organization feels comfortable speaking up and bringing things forward. Joint Commission Sentinel Event number 58 about inadequate handoff communication. Of course, communication is always 1, 2, 3, and all the Sentinel event alerts, so that was an easy sell. We did a culture of safety survey 2 years ago, and Missy will reference that in a little bit, and we found some opportunities, and again, communication came to the forefront on many of the issues. So in talking with our senior leaders, we decided we were not going to wait 2 years. We did another one actually recently. We will be getting our results very soon because we wanted to have another measure of how we were doing and to close those gaps. And finally, talking to them about event reporting. I know different areas, different quality and safety people have different event reporting. Ours is Quantros, and when I started as a patient safety officer, I was really excited because 1 month we had about 35 event reports, and the next month we had about 28, and I was really excited, and I thought I was a great patient safety officer because I was making our event reports go down, and I realized, no, that means people are not bringing things up. So we actually made it an organizational initiative as part of our safety and quality pillar that we wanted to increase them, and now I'm proud, so to speak, to say that we get over 100 a month. And this gives us things to work on and things to bring forward into our projects, into our simulations, and so on. So using the cultural argument of your safety and quality pillar and having those conversations with the senior leaders, that's what helped get us the support for this. But you know, the actual work becomes at the grassroots, as I mentioned before, those relationships that you have with the different areas. Decided to address the elephant in the room before we got to question and answer because I know that's on a lot of people's mind. Every month when I teach hospital-wide orientation, without fail, I get asked this question. And I really struggled with it for the first few times I did it because I would love to say yes, but the answer was no. And in California, you know, doctors are not employees of the hospital, so we cannot require them to do it. But I came to the realization that I was not going to make this answer binary anymore. It's not yes or no, because if we go with yes or no, we're always going to lose because we can't make everybody do it. So rather, we're going to say we're going to take the wins that we can get. As I mentioned, I graduated physical therapy school in 1982, so I've been in healthcare 37 years. Believe me, I've seen the hierarchical part of healthcare. So if you told me today that the chief medical officer of our hospital would Facebook friend me, I wouldn't have believed it. But then again, if you told me 37 years ago that it would be Facebook, I wouldn't have believed that either. But we find that with the next generation of physicians, they are much more amenable to open and talking and learning about this. So it doesn't have to be within the context of a formal class, but you can have these conversations with them. I talk with the doctors when we have a situation. You know, I've had some of the older doctors say, you know, you're going to give me that TeamSTEPPS baloney. They're not interested in it, but the younger ones are. They want to learn how to be collaborative, and they want to understand when the nurses and the other staff are talking to them, you know, what some of these terms and some of these things are doing. And the doctors want it. They're busy too. We're all busy. They're fast-paced. Everything's getting condensed. We have to make it, you know, the old WIFM, what's in it for me. If we can show them that this is about keeping your patient safe in the moment, again, the impactful story, this is why, this is how we're doing it, this is going to be more successful. And as well, we found, you know, that there are some of the, you know, more experienced doctors that, you know, are just not interested, but we've had some, these are their words, not mine, they've seen the light, and they realize that this is important. And we have several of the older physicians who have come into our quality department and some of our operational initiatives, and they do help us with this. But we also go to our hospitalist group and you know, different groups, and we do have these conversations with them, and they do want to learn. So strategies for awareness. As we talked about, it's really important to get the whole organization involved. And for the strength of your bench, we talked about, you know, before it was John and Gina, and that's not sustainable. As John moved on to another organization and Gina took on another role, suddenly, you know, we were very thin there. So that's how we said, how many people do we need to reach even just the nursing? And we have 1,300 employees. Even with 3 people, we don't have the dedicated time to do that, and we have to make it a priority. So we did identify the nurse educators. There were a couple of nurse managers and myself who went and got the master training. So you're going to have to do an assessment, not to spread people out too thin. That's why, as Missy mentioned about the you know, the administrative assistant, for clinical people to be doing all the things they have to do and try to plan meetings and get notes together, you know, that can sink your meetings and sink your plan. So you have to be prudent in getting enough people to do this work. As far as the training, who we are training now, currently we are training all clinical people. It is all new hire clinical people, and our pillar goal was 75% of current clinical people. And I see a question, retrain. We are going to retrain every year. That they either have to attend a simulation or they have to attend a refresher course, because new things come up, situations come up. So our commitment is to get all the clinical staff in, eventually the non-clinical staff. How to message it, we have all kinds of ways. We do it in hospital-wide orientation. We have a monthly leadership meeting that I present at, that I talk about. We have our simulations. I do something called a safety message of the week. Every Wednesday morning I put out a note, and very often it is referencing a TeamSTEPPS concept or a story where TeamSTEPPS concepts have been employed. We do it in education, in ICU and in maternal child, and with our CNAs we have a newsletter. As Missy mentioned, we have to keep getting the word out and keep talking about it so it doesn't become just another thing, but it becomes part of our everyday language. And then spreading the word, we embed it in our educational opportunities whenever we can.
So in doing our TeamSTEPPS revamp, when we initially were rolling out the first iteration, I guess if you want to call it, that we were really restricted on what content we could present from like an organizational standpoint. It was hard sometimes to replicate the content of our TeamSTEPPS training because the content was based on past experiences from our presenters, so it was always a challenge to try and replicate that. And so when our educator group most recently just went to the master training the end of last year, we came back with a lot of great ideas and videos and new games that we can implement. It's kind of funny in kind of debriefing and looking over our first version of our program, because for those of you that have had a program for a while, for us, doing the paper chain activity in our initial training was our gold standard, so to speak. We did that activity every training, and so sometimes staff would know when they either come back years later to get the TeamSTEPPS training again, or they would just hear from the hustle and bustle in the department, they knew that they were going to be building a paper chain. And so a lot of times we were hearing that staff were walking away from our TeamSTEPPS training saying, oh, I can make a really good paper chain, and they weren't walking away with the key concepts we were hoping they would be. So in coming back from our master training and talking about revamping our content, we were really excited to start bringing in new videos and games and changing it up a bit. And so what's nice is like Joe mentioned, we're using the real stories from events that are happening in our hospital to make it more real, to make it more relatable to our staff. We are using those different activities and videos, again, so they're not just sitting and listening to us and playing the paper chain. They're getting up, they're making different structures, or trying to make a cup pyramid, and so we're able to kind of use new activities and updated content in our training. And the other component that is really nice is we can tailor our education to different departments, or for different departments' needs. So maybe content that would be better suited for our ER, we can tailor our content to that, and that would definitely be different than something that maybe a med-surg or outpatient department might need. So it's nice that we can kind of customize the training for these areas as well. As Joe has mentioned, we're using TeamSTEPPS language in really all facets as much as we can. We know our staff are doing TeamSTEPPS. They just aren't partnering or pairing it up and recognizing that when they're stopping the line or they're going up the chain of command that is TeamSTEPPS. And so we're really trying to, when we have a situation like that, use those TeamSTEPPS concepts and terminology, so that way staff, again, are having that understanding of what they're doing really is TeamSTEPPS. We're using it in staff meetings. I'll mention again briefly in the next slide about the different educational opportunities we're using it in. So really, our staff are doing TeamSTEPPS. We're just trying to pair up the actual TeamSTEPPS verbiage to what they're already doing currently. As I had mentioned, we are using simulation with our TeamSTEPPS. So all of our staff, clinical staff, are required to attend one simulation a year. It doesn't have to be the department you work in. I actually have some ER staff coming to my simulation next week. But as long as they are attending one simulation a year, that fulfills the requirement. And we've added our TeamSTEPPS refresher to every simulation. So we start our simulations with TeamSTEPPS refresher, go over the different concepts. We do our simulation, and then we debrief after it. And so each department is essentially tasked at coming up with whatever simulation that is beneficial for their department. And to be honest, when I was first tasked to start doing simulation for med-surg about 4 years ago, it was super overwhelming for me. I have over 200 staff members just between our nurses, CNAs, and unit clerks that I needed to ensure was attending our simulations. And so the thought of having to coordinate that and schedule that was just super overwhelming, because I'm thinking I'm going to have simulations every week in order to get staff, at 100% attendance. But really, simulations don't have to be this big, grandiose event. I think a lot of times we kind of think of simulation that you have to do this full-blown patient scenario, and you don't. You want to look at what are your organizational initiatives, what are the industry standards that you want to maybe bring into your organization. we're talking about doing just short little S-bar simulations. I was actually just talking to our maternal child manager yesterday, and they've started doing computer-based simulations. So they're really trying to improve upon the documentation and the ordering and the releasing of blood products for their massive transfusion protocol. So the last couple simulations they've done, they've had their staff come, sit at the computer, and they walk through the steps. And so that's a version of simulation that you can do. So really, you want to think about what within your organization are areas that you're wanting to improve upon, and just make it real for your organization. Make it work for your organization as well. I had mentioned that we started having outpatient department simulations, so we started those at the end of last year. Our physical sports medicine department is doing simulations on falls. Our SNF department is doing different medical situations and codes. And so really, again, it doesn't have to be this big, drawn-out production of simulation. You can just kind of chunk it, if you will, into smaller pieces that you're wanting to improve upon within your areas and within your organization. And really, we are trying to incorporate TeamSTEPPS in any and all facets that we can. So our staff development department has done an incredible job at incorporating TeamSTEPPS refreshers in our preceptor class and doing activities for better communication. They've been incorporating TeamSTEPPS content and activities in our CNA classes that we offer, and really just anywhere that we can add a little TeamSTEPPS refresher. So again, staff are realizing what they're doing on the unit really is TeamSTEPPS, and having that alignment be better matched up. I did see a question about asking for an example of using TeamSTEPPS in a meeting. We are, for MedSurg actually, we are going to be doing an activity in our July staff meeting the end of the month, which I'm actually really excited about, where we're going to try and make this pasta structure. That it was a activity that we did at the conference, and so it's going to be a really great team building exercise for our CNAs and our nurses to work together to have better communication, work better as a team. So we're really excited to do that. But just incorporating little activities here and there at a staff meeting, or just really anywhere that you can do it.
And I asked Missy if I could jump. Great questions. Thank you, everyone. So, yes, Karen, another example, couple things is we have a monthly leadership meeting where when we have someone, we have Safety Star, and when someone stops the line or does something, uses cuss, or we bring them up there, we recognize them, we have them tell their story. Again, the high impact where the people telling the story, and it empowers other people, because when you hear someone being successful and being recognized, that goes a long way toward motivating others. In my staff meeting, I do the same thing, like in my physical medicine staff meeting. When I have people that have done that, I bring them in, I say, tell everybody what you did and how it went, and we debrief it a little bit, and the more we talk about it, and again, use these real life ones, the more comfortable people get. This is again why the real stories are really important.
I did also want to talk about and reference an article from the Institute of Healthcare Improvement. Jen's going to post the link in the chat box so you guys can reference this article, but it was 3 myths about simulation. And the 3 myths were that they're only for running drills or task training, that sim is only for nurses, which is not true, we all know that. And then also that you need expensive equipment to run a simulation. And so again, as I was mentioning, simulations really do not have to be this big, grandiose production. For this spaghetti exercise that we're going to do, it's tape, yarn, and spaghetti and a marshmallow. And there's a lot of really great activities that you can do that are very inexpensive. So I definitely recommend attending the TeamSTEPPS or the AHA conference next year, because we just came home with so many great ideas to incorporate from this past conference last month. Measurement. So we're doing all this great work. We're offering all these trainings. How do we know if we're doing a good job? So as we had mentioned, we are requiring our staff, our clinical staff, to attend one simulation that has the TeamSTEPPS refresher content a year. And so ideally, of course, we would like to have 100% of our clinical staff attend this, but we've really set a benchmark for 75%. And so attendance is tracked, and then we also do course evaluations. So after each simulation, there's an evaluation that staff need to complete, and we review those and see how we can improve upon them after. We are talking about doing a pre and post test, and then also like a 2 or 3 month out evaluation. And so hopefully, you know, because this is an annual requirement for our staff to attend, we would hope when we provide the pre-test that staff would have some idea of what our TeamSTEPPS concepts are. And then we do our training and our course, and then we do the post-test, and then, of course, we would hope and assume that we would have a much higher understanding of the content. And then, again, we've talked about, and we haven't implemented this, but we've talked about doing either a 2 or a 3 month evaluation of the program, the simulation TeamSTEPPS refresher program, to really see and capture whether staff are feeling empowered and encouraged to use the TeamSTEPPS content. You know, maybe they've picked up a different component that they haven't been using, and now they're using it in their everyday world. So really just kind of gauging and seeing how is our program working at that time, or I guess just in general, are staff really walking away with the concepts in hand and utilizing them. In this slide, you guys will see our 2018 Culture of Safety survey results. And I know Joe had mentioned earlier that we should be getting our 2019 results anytime, so we will definitely be comparing 2019 data to last year's and seeing how, you know, how is the improvement, what does that look like. But in these 3 categories, we asked staff, you know, how do they feel? Do they feel that different units work well together? And so about 2/3 of our staff said yes, they do. So, you know, we have some work to improve upon there. And then the communication questions, the 2 main ones, is that communication is effective between units and then between physicians, nurses, and other medical professionals. And so a little over half to 2/3 of staff feel that communication is good. But again, we can always improve, especially on communication. So it will be interesting to see, you know, hopefully, we're hoping that the red and the yellow areas have gotten smaller, especially the red part. But yeah, so this is a way that we are kind of measuring to see the effectiveness of our program.
So what are our next steps? As I mentioned, this is an ongoing project that we have. This was just not about redoing our hospital-wide orientation project. We have different things that we have on our plate. One is doing a distinct leadership refresher class, because a lot of this has to do, someone asked about, you know, retraining staff, and it's important that the managers and the leaders and the directors all know the language and can support their staff using things like role play and examples in the staff meetings and things like that. So we are working on a specific thing, refresher course just for leaders. Also a distinct refresher course for current employees. Currently, we have them attending our hospital-wide orientation and are getting the information there. Some people haven't gone for 10 years, so you know, we want to get them back into the swing of things. So either through the simulation or some of the refresher course, we want to a little peek into it. A goal is to do a little bit more active thing, role play and practice versus concepts. The idea of more master trainers. Chris had asked about master training necessity. Is it absolutely necessary? No. I started, as I said, with Gina and John, but I found my ability to teach this exponentially better once I had taken my master training class. As Missy mentioned, you get the different exercises, you get examples, you hear from people who have done this a long time. Highly recommend it. So we actually want to determine how many more master trainers we need. We have some departments, some of the ancillaries like pharmacy and DI and lab that may not have anybody to support them like the nurses do. And so we're going to be looking for support for those departments as well. Our next goal is to roll out the non-clinical staff, both in hospital-wide orientation and in future trainings. Obviously, physician engagement is really important, so seeking out how can we better expose the doctors to it, maybe some of the groups that we work with and so on. So that is obviously a focus. And as Missy mentioned, we want to improve our internal measurement tool so that we can continue to evolve our program. In the past, it was, you came, great, thanks for coming. Now we want to make sure that people are getting more than just being able to make a paper chain. So the takeaways, hopefully, excuse me, from if you've used your sheet and you've jotted some things down, some of the important things, you want to find the stakeholders, the physicians, the employees, that will help you to evolve this. Don't try to take it on one or two people. It's too big a job. So you have to get an involved group to advance this. Find your Joes, again, not necessarily the person, but the characteristics to help you promote your program. Use all the methods you can to spread the word so that the language becomes part of everyday conversation. It's not just another thing. And then evolve your program to meet your organizational needs. As for the leadership, the measurement initiatives, Missy is doing, because we are applying to become a stroke center. So now we have included stroke simulation in our program. So things are always changing at your hospital or your organization. And again, because of these changes, you want to have things updated. You want to be able to be up to date on concepts and ideas. Chris put in some links for ideas, but you will get them at the master training as well. So this is something that's going to be ongoing. We truthfully, let it lapse a little bit in the beginning, and we had to do a lot of work to get it back up to where we want it. We feel really comfortable where we are now and where we're going. And so the goal of this presentation was to get you to start thinking about, before you get to a lull in your program, start doing that succession planning, so to speak. Start thinking about how you can evolve it for your organization. And at the end of the conference on the tool, the people writing, I asked everyone, make yourself a promise that when you go back to work on Monday, you're going to do one of those things in your boxes. So if you have that, make yourself a promise that tomorrow you're going to connect with a doctor, or you're going to look for a different kind of simulation, or you're going to look at how you measure, or you're going to find your key stakeholders. It's easy to let this slide, as we found out, and our hope is that we will motivate you to not let it lull, but to keep it robust and let it keep growing. So with that, we thank you for your attention, and we have time for a few questions.
Thanks, you guys. That was really great. I think especially your last point there, where you were talking about connecting things into other organizational initiatives, it's really important for people to think about this not just as a training program, but as something that could really help you do everything that you're doing. It's not something else to do, it's something to help you do everything else, right? So that's I think a really, really great point that you made there. You answered a lot of the questions that came in over the chat, so I appreciate that. Looking over at some of the questions that came from earlier on, somebody here was asking a question about, what kind of, coach training is available. I think that, what you guys are doing is really important, having those refresher courses to keep people going. From our perspective at the AHA, we've really been looking at what can be done to help people moving forward. We have a TeamSTEPPS Next Steps course that we developed that kind of helps people maybe make some more of those connections and connect the dots a little bit more. So I don't know, are there any other options that you guys have done with coaching, specifically coaching in the moment or anything along those lines?
Actually, I was talking about this yesterday at our educator meeting. A big takeaway for me personally from the conference was whenever you're in a situation, whether it's a real situation or a simulation and we're debriefing, really kind of when staff are talking about what went well or how can we make things better, really always kind of taking what they're saying and connecting it to a TeamSTEPPS conference. So again, they're getting the connection that what they're trying to explain really is a TeamSTEPPS component. And so again, just talking about TeamSTEPPS as much as you can in every facet of work, because it really is so vital to all parts, whether it's clinical, non-clinical, and where, depending on where you are in your organization with your program, but just making sure that everybody, and regardless of role, you want to be talking the same language to your CNAs and to your physicians, so everybody is on the same playing field and can speak the same language is very, very important.
And Chris, a thing that I do as patient safety officer, and those of you again in the quality and safety, when I round in the hospital, and what's nice is people will walk up to me and say, I have this situation, and I love when they do that, but the thing is they want me to solve their problem, and I say, I'm going to help you solve your problem. So we talk about, we might do a little role play, we might do a little conversation. I might give them, some, a little bit of on-the-spot tools or practice for the conversation, and then what's important, because a lot of it is psychological safety, right? We tell everybody use these tools, and then they go and then they get their head bit off and they say, I'm not listening to you anymore. So I stay there and I say, I will wait here. You go do this. Come back, tell me how it went. We'll work it out. I'll support you. So knowing people are there to support their efforts, if we can get them comfortable enough with it, you're absolutely right. In the moment is the best. And we always turn it back and say, I don't want to do this conversation for you. I'm going to help you to have the conversation.
Yeah, that's great. Yeah, you're really helping people to translate, translate things into TeamSTEPPS speak from what Missy was saying, and then what you're saying, Joe, there is you're helping them make those connections. In a way, you're getting them on a very large level to think in a way that is mutually supportive of everybody, that really even speaks to the concept of something like SBAR, where you're asking somebody not only to bring up a situation, but to get to their assessment and their recommendation how to fix things. So that's kind of cool.
Thank you.
Well, we are at the top of the hour, so I know that some folks sent in a couple questions at the end here. Both Missy and Joe said that they would welcome your questions directly to them. So their email addresses are on screen right now. So if you want to copy those down, everybody, if you have a question, if it wasn't answered, or if you think of something going forward, feel free to shoot them a question, and they said they'd be willing to answer. So with that, I'd like to thank you all for attending. In the coming days, you'll receive a email with a link to evaluation, so you could please fill that out. That would be great for us. We always look at them. We always share them with the speakers to help them as well. But if there's nothing else, I'd like to thank Joe and Missy, both of you once again, for taking the time out to do this great presentation, and we look forward to seeing everybody on the August webinar.
Thank you.
Thank you. It was our pleasure.
Ladies and gentlemen, thank you for joining today's conference call. The call has now concluded. Please disconnect your lines, log off the webinar, and have a great day.